Medical tools that killed you. Shocking but true. Imagine going to the doctor with a simple headache and leaving with blood loss, infection, or worse, death. The Victorian era was a time of great medical innovation, but it was also a time when people were dying from everyday things. In this era, medicine was not the safe, sterile science we know today. It was brutal, experimental, and often lethal. And the very tools designed to heal could just as easily kill you. The average person today has no idea how dangerous life was back then. Today, we're diving into the shocking world of everyday Victorian medical tools that ended more lives than they saved. Subscribe to our channel if you like our content. Let's start with one of the most common treatments of the time, bloodletting. Doctors believed that almost any illness, from fevers to infections, was caused by bad blood. So they used tools like scarificators, which were small brass boxes with rows of hidden blades. With the push of a lever, the blades would snap out and slice the patient's skin, causing them to bleed. A lot. Then came the fleam, a spring-loaded lancet used on both humans and livestock. And yes, sometimes the same tool was used for both. Unsurprisingly, these procedures often led to massive blood loss, shock, and deadly infections. Ironically, bloodletting was supposed to heal, but it became one of the most dangerous cures of the Victorian age. Next up, the terrifying tonsil guillotine. This handheld device looked like a cross between a pair of scissors and a miniature executioner's blade. Its purpose? To slice off infected tonsils in one quick motion. Sounds efficient, right? The problem was, these tools weren't sterilized. Germ theory was barely understood, so doctors reused the same blade over and over. Many children, because tonsil removal was most common for them, died not from their infected tonsils, but from post-surgery infections like sepsis. The tonsil guillotine was quick, but it was also a silent killer. With the invention of new surgical techniques, diseases could be treated, and people could live longer than ever before. But with this progress came new and deadly complications. Childbirth in the Victorian era was already incredibly risky. Enter the obstetric forceps. These massive metal tongs were used to grip a baby's head and pull it out of the birth canal during a difficult delivery. In theory, they saved both mother and child. In practice, they often caused severe injuries. Babies suffered crushed skulls or brain damage. Mothers endured internal tears and life-threatening hemorrhages. Worse still, these instruments were rarely cleaned between patients. Postnatal infections like puerperal fever, a bacterial infection, claimed countless lives. What was supposed to be the miracle of birth became a deadly gamble with a pair of forceps. Now let's talk about one of the most horrifying tools, the trephine drill. This was essentially a hand-cranked drill designed to bore a hole into the skull. Doctors believed this procedure, called trepanning, could relieve pressure, cure seizures, or even treat mental illness. But without anesthesia, antibiotics, or proper understanding of brain injuries, it was often a death sentence. Even if the patient survived the procedure, infection almost always followed. In other words, in the Victorian era, brain surgery was performed with the same precision as drilling into a block of wood. Let's turn now to the syringe. These were also often reused without being sterilized, which led to the spread of deadly diseases like tuberculosis and hepatitis. Another fearsome instrument was the razor. Razors were another common cause of death in the Victorian era. Again, if they weren't sterilized, razors could transmit diseases like syphilis and tuberculosis. Finally, let's not forget the clister and early enema device. Doctors used it to pump fluids, herbs, or even substances like mercury directly into the patient's body. The practice was meant to cleanse the system, but more often than not, it poisoned people or introduced deadly infections. Imagine trusting your doctor, only to be literally pumped full of toxins. Sometimes, the cure really was worse than the disease. The innovations of the era led to many advancements in medicine and technology, and people were willing to take the risks in order to improve their health and well-being. The Victorian era may look glamorous in period dramas, but step into a real doctor's office back then, and you'd face tools that were crude, unsanitary, and deadly. These instruments remind us how far medicine has come and how many lives were lost along the way.